Ready?
Sure.
Alrighty. The first one for your intraoral is Intraoral Masseter. You might want to lay straight back. And you basically glide down. I'm going to stick my finger in your mouth. You glide down from the zygomatic arch down to the inferior angle of your mandible, of your jaw. You manipulate and you compress the deep bellies, and you manipulate and compress the zygomatic arch attachments. So for this one, you want to remember it's ipsilateral. You're on the side of the table that you're working on. Open up. And you're going to be working on the outside of the teeth. So the pad of your finger will be on the cheek. The fingernail will be on the teeth. Remember that. Pad on cheek, nail on teeth. You basically just sort of hook into this part. You can close now. Yeah. And you dig down to the masseter. Get my nail off of you. If you want to find out exactly where the muscle is, ask them to do the action. Clench your teeth for me. And it's right there. Okay, you can relax. And you're always gliding down. It's because it's the parotid gland. So you want to try and keep your finger off of their, fingernail off of their teeth, but always glide down. Do not glide up. Do not glide in any other direction. Just from the zygomatic arch all the way down to the mandible. And you actually want to support it. Support it with the back of this hand, because you don't want to get the glove like infected or anything, because you're going to stick it in the mouth. So support it with this hand and glide down. For the next step, you're going to remove your hand and compress the muscle belly. Now, complete honesty, when I do this, I'm pretty much moving just my thumb. And you want to compress from the top of the muscle belly. Manipulate if you want to. And you work your way down. Work your way down. This is the other one I had actually. Work your way down, all the way down to the jawbone. And then make sure you catch the superior attachment, which is inferior aspect of zygomatic arch. You want to manipulate and compress there too. Masseter has two bellies. It has a superficial one and a deep one. So the deeper I go into here, the more of the deep belly I actually work on. You can just compress, or you can compress and manipulate. Either or. Your precaution, of course, is the parotid gland and duct, because it's the salivary gland. It will cause them to start spitting. So if you feel anything spongy, get off of it. And that's it for Intraoral Masseter.